The number of people waiting for organ donation is increasing day by day. However, there's a scarcity of donors. To donate, one needs a lot of willingness, also strength and inner courage. The donor has to go through a process in order to donate. However, he also needs to be in the hands of a very good doctor. He needs to have that confidence. Today, we have with us once again Dr. Pradnya Diggikar.
Thank you.
Who from 2006 has been working on organ donation. We already saw that she also focused on geriatrics and vaccines. We are at the Dr. D.Y. Patil Medical College Hospital and Research Center, Pune, Maharashtra. Dr. Diggikar. How do I address you? Dr. Pradnya Diggikar?
Pradnya.
Just Pradnya Diggikar. Okay, Dr. Pradnya Diggikar. My first question to you again is, what is brain death and what are the causes of brain death?
So, a very good question, ma'am. Thank you very much for introducing me, Prajakta. The subject is what is brain death. So, whenever patient is coming to you, any accident or any ischemic stroke, there is stoppage of blood vessels of the brain. Because of that, that is called stroke. So, blood vessels of the brain are blocked, and or sometimes because of the road accident, the patient is brought to you in the hospital. So here, when you examine, he is in comatose, he is not responding to you, no verbal shouting, so he is in coma. So now you have to differentiate between the coma and the brain death. So here, sometimes what happens in coma patient can recover with the treatment, whatever cause may be electrolyte imbalance or any acidosis. So if you treat that conditions, patient will come out of it and maybe discharged, or he will land up into vegetative state, or he will land into the brain death. So here, when you examine the coma patient, there will be slightly respond to your light reflex. When you open the eyes and you throw the light of the torch on the eyes, there will be little reaction. But in brain death, there will be dilated and fixed pupils will be there. In brain death, sometimes if you give painful stimulus, he will little bit respond. Sometimes hearing will be there, mild hearing will be there, or there will be some reflexes of the brainstem will be there. But in coma, in brain death, what happens whenever you examine the patient, the pupil light reflex, you will get fixed and dilated pupils. There are some tests. You have to go through the test. So in eye examination only, you have to do the corneal reflex. So what is corneal reflex? The person is sleeping, the patient is lying on the bed. So his eyes are closed. So what happened? Your assistant will pull the upper eyelid, and then you have to touch his cornea from the side. So his lower eyelid will move because he is in coma. So if he is in brain dead, there will be no lower eyelid movement. Same with conjunctival reflex. Same, you have to touch the conjunctiva and there will be movement of the lower eyelid. Normal, but not in brain death.
Okay.
So these are the eye signs, eye reflexes. The second is the pharyngeal gag reflex. So you have to put the tongue depressor and touch the pharynx of the patient. So there will be cuff reflex. But in brain death, there will be no cuffing. Then patient is already unconscious or in coma. So you usually, whenever patient comes, you intubate the patient and keep him on the ventilation. So through the intubated tube, you have to pass the catheter and irritate over the trachea. So if the patient is brain dead, there will be no response.
Okay.
So this is the test, and then you can go for the other test is oculocephalic reflex.
Okay.
So whenever you turn the head, your eyes will move.
Okay.
But here there will be no eye movement.
No eye movement.
So that reflex will be there. Then one is the caloric test.
Okay.
So here you have to keep the patient on 30-degree angle, and you have to take the ice cold water in the tray, and you should have a 50 ml of syringe and a small catheter. But before that, you should examine the ear examination. There should not be any perforation or wax inside the ear. So here, you take the 50 ml of water, put the catheter inside the ear, and push the water 20 ml, 30 ml.
Okay.
And after 1 minute, wash the eyes. So there will be, if cold water, so opposite eye movement will be there. But in brain death, there will be no
eye movements. Okay.
Okay.
All
So
right.
these are the different
Tests.
tests are there. And whenever patient, then if it is not there, then you say this is the brain death patient.
Okay.
Now here you have to fill up the form number 10.
Okay.
From the, so I wanted to mention it. There is a NATO and ROTO.
Okay.
So these are the, or SOTO. So yeah, yes, your question will be what is it?
I would want for the audience to know, right? It's so important.
It is National Organ Transplant Tissue Donation. That is NATO. So whatever, whenever you search on the website, you will get all those forms. So NATO is national, and regional, that is ROTO or a state level. So state level also there is organization, and national level also the organization. Now our patient is brain dead, so you have to fill up the form, take the consent of the relatives, and now you can go for the apnea test.
Ah, yes, I read about that.
Yes.
Yeah.
So it is very exhaustive, but everybody should know what is apnea test.
Yes.
So here, the apnea test prerequisite you have to do means you have to take the consent of the patient. You have to take the patient. Then first you have to collect the blood of the patient. For what? ABG. To gases changes. You have to go for the blood gas changes. So you have to collect the blood sample for the see the level of the oxygen and carbon dioxide. So first collect the blood. Then second, you have to, patient is on the ventilator, so you have to give the oxygen 200% like that.
Okay.
Then then after giving oxygenation, so patient is having oxygenation of the lung is there. Then you have to give the FiO2. There is a monitor, and you have to give the FiO2 more than 100 there. So that is the level here. Now what happens? You have to remove the ventilator. So you are disconnecting the patient from the ventilator. So now you wait for 8 to 10 minutes. So if he is not brain dead, he will take inspiration, or there will be respiratory movement of the chest. But if after 10 minutes also he is not responding,
then he is brain dead.
Yes. So think of brain dead. Now you collect the blood sample, and here your carbon dioxide should be more than 60.
Okay.
For that 60 level of the carbon dioxide, our respiratory centers get stimulated, and then you take the inspiration or expiration. But at that level also he is not taking, then he is brain dead, and the level is usually should be more than 60. So now we declare it as a brain death patient.
Actually, my next question was exactly this, because I read somewhere that if a person is put on a ventilator, then he can have a little bit of movement if once you declare him brain deaf. So I was kind of a little confused, and I thought maybe, I should ask you. So
yes, madam, what happens if there is a trauma to accident happens? And because of what there will occur bleeding, and there will be edema of the brain. So what will happen? There is no space because the skull is hard. So it will not expand. So what will happen? The swelling, and it will go downwards, and there will occur coning. So it will compress your brainstem. So our centers are there in the brainstem, cardiac center, respiratory centers. So because of that, what will happen? He will land up into the coma or brain death. So your question is,
how do you determine brain death?
Yes, when the blood supply to the cortex is it is not there. There is no blood supply. It will occur ischemia. So it will the oxygen is not there to the brain tissue. So there will occur death of the tissue. So same thing happened to the brainstem. There will be no blood supply, no blood supply, so no oxygenation. So this cerebral cortex and brainstem death, this is the actually death of the patient, and that is the brain death.
Okay.
Yes, but heart is having its own pacemaker, so your heart beating will be there after brain death also.
That is what I wanted
Yes,
to know.
yes. And when you keep the patient on the ventilator, you are supplying oxygen to the lungs, and then the blood is going to the heart, and that's why they are beating, and oxygenation is getting to the lungs and the heart, and that's why patient is there, but he's dead.
He's dead.
Dead, but we can maintain. And this is the situation where you can you can keep the organs alive, means functional, and you can wait for that. So heart will remain for 4 hours, lungs will remain for 6 hours.
Yes.
Liver will 8 hours, then 10 to 12 hours pancreas, kidney, and 36 hours kidney will be there.
Yes.
And one brain dead patient can give life to 8 persons.
Yes, I know.
Yes.
There's so many people waiting for donations.
Yes,
you know,
yes.
we just
Even in
spoke to someone.
United States also, madam, 120,000 are waiting for the organs, and there are supply is 50%. So there is even in what you call the advanced countries also, they are having gap between the demand and the supply.
We have a large gap.
Yes,
we
madam,
have
we are-
500,000 people dying every year
yes, ma'am.
because of lack of organs.
Yes, madam. And this education should be there for, you should promote this organ donation. You educate all the patient relatives in the school, in the colleges. They should teach this so that they will be the organ donation promotion will be there. And at least this is the teaching. We should teach them what is yes.
Sorry for interrupting. I know that you do these little camps.
Yes,
to educate people. Besides you, are there other doctors who are actually doing this, or hospitals, or I don't know, social workers, etc., who are spreading the word that we need? Because 500,000 every year dying is a large number.
Yes, madam. Yes, madam.
Because of lack of organ donation.
So we are having that NATO, ROTO. So those people, even in some part of the hospitals, they are promoting. They are having organ donation coordinators.
Okay.
They are arranging meetings.
Okay.
They are arranging conference, and they are promoting. They are teaching to the doctors also. We are teaching to the students also. Our undergraduate teachers, students, under postgraduate students, interns. We are taking lectures. So we are doing at the health level, but it should be taken up by the media, by the politicians. The proper education should be there.
Yes.
Correct words should be used.
Yes,
yes, the word should be proper.
Yeah.
The your aim should be to help the people. Yes.
The aim should be noble. Absolutely. Yes. Yeah, you're very well said. Well, you answered some of my very important questions. You also spoke about the prerequisites, some of the tests that an organ donor has to go through. However, there are also certain health checkups. What are those? I mean, the organ donator would have to be in good health, right?
Yes, yes.
So what are those health checkups that the donor goes through? If you can enumerate them.
So here, whenever somebody wants to get registered, for suppose I have taken the camp and my student said, madam, I wanted to get registered. So form number 1 is there. So form number 1, there will be, you are declaring that I will donate my organs after my death. Okay. So this is the declaration. Then form number 8 is there. So he has to take his consent, means his signature and his close relative signature.
Okay.
So that is form number 8. So the other forms are there. I said about the brain death form. Like that. So here pledge form is there, form number 7. So in US, because my daughters are there, they are having the card for the, like our Aadhaar card, and there they have written that I am willing for the donation. So that country has given, you have to give the, if you want the card, you have to give the consent that I will donate my organs if anything happens to me. like that.
So yes, that's the consent, and the relatives also have to be involved, I gather, of there. But I think to be in perfect health, when he gives this consent, would he not have to go through certain checkups, check for diabetes or check for, other health conditions?
So, madam, it should be a regular checkup for everybody, because nowadays young boys are coming with chest pain and hypertension and kidney transplantation. So they are not aware of their how to take care of your organs. You respect your organ. I usually tell to my student. So each organ is very important, and you have to take care of that organ with 5 principles: eat healthy food, sleep well, exercise. These things you should have a healthy habits in your life. So if you are doing exercise, you are eating properly, sleeping properly, and not taking any tension, no stress. There should not be any stress, and no addictions. Sorry,
Drug addiction.
yes, no smoking
Alcohol.
and no alcohol. So I am teaching all lectures. If you are aware of this, you will not get diabetes, hypertension, even cancer. Because even in cancer also we are telling to do these things. So many you can prevent the prevention of cancer by following these
Steps.
good habits. Yes, and for organ donation. So these are the things you should not have any habits. Your blood sugar level should be normal, no diabetes. Keep your hyper BP in the normal range, so that your kidney will be normal, your eyes will be normal. So don't eat outside. So your liver will be normal because even some habits.
Yeah.
Contacts, multiple partners. So you get that infections.
Yes.
Hepatitis B, C, syphilis, VDRL should be normal. Your Western blot for HIV should be normal. So these are these are preventable by having healthy habits. You will be normal for your life. The organ donation will come afterwards. You have to take care of your health first. So regular checkup too, I will recommend go to the physician. Go to the proper physician. He will tell you. Definitely he will guide you.
The kinds of tests to be done.
And how to take care of your organs or your health.
Yeah,
and
today,
yes,
food has really become very, very important. The kinds of food that we eat, with so many things being chemicalized, so we really have to take care. There's something else that I need to understand, and I want for my audience to understand. You say living donor, you have deceased donor.
Yes,
those kinds of things. Can you just explain that a little bit?
Yes,
the difference between all of this.
So in living donor, for example, we are having 2 kidneys and we are having 1 liver, but 8 segments are used.
Okay.
So if I have seen in the hospital, mother gives kidney to her son or daughter.
Okay.
So this is living donor. Or what happens sometimes due to paracetamol poisoning or something, acute fulminant liver disease, suddenly the liver get damaged. So in this condition, the mother or blood relative can give the liver because of the segments. So part of the liver can be donated to the recipient.
So that is a living donor.
That is living donor.
And the diseased one.
Diseased one is this after brain death. So you can he can donate he can save 8 lives of the patients. So 2 kidneys are there, liver you can give. Then even part of the pancreas, even in living, part of the pancreas can be given. Yeah. Then intestine you can give. Then eyes, intestine also. Yes, madam. You can give skin, intestine, and eyes, cornea. We can donate.
And each one has a specific time frame, as you mentioned earlier.
Yes, so
within that time frame.
Yes. 4 to 6 hours heart and lung, then pancreas, liver 6 to 8 hours, and like that 12 hours, and kidney for 36 hours.
Wow. And how much of the family's involvement is required over here? Like I say, I want to donate, right? Can the family obstruct and stop you from it?
I think they should not, because family, if you counsel them that this has happened, and so this is the part of this is taken care of by the organ coordinator and social workers, not the physicians, because he is a treating physician and he will not talk about this, that patient is brain dead. We'll say that patient is serious, he is in bad condition, he is, so that they will counsel the relatives. So what they will say, that the brain death has occurred and nothing will be improved with the treatment. So if you want, you can take, but there is one option. If you give the organs, because his organs are normal, he doesn't have any other disease, and if you give the consent of this, so 8 lives will be saved,
Yeah.
and they will have a life.
Yes.
So there will be a gift from this
Yes.
to the recipients.
Yes.
So the counseling will be done by those people only.
Okay. All right. So I feel that we over here need to be more educated, because I think in other countries, the disparity
Yes, madam.
is not as much as we have over here in India. And you've traveled the world.
That's my passion.
Yeah.
So what I have observed in European countries, madam, Spain is number 1.
Okay.
Croatia, France. So these are the countries, they are 40%, 42%, their organ donation is done there and the surgeries are done there. So, and in Netherlands, it's such a small country, there is a monument, Nadim place. So that person is carrying a box of organ donation. So how they are promoting? See the level of the promotion and how the people are following. So I hope we should go for that.
It is so necessary to look after our health. Even where vaccines are concerned, which we spoke the last time, we need to be educated
in the vaccine also.
Yeah, absolutely. Is there anything else that you would like to tell our audience about organ donation before, I talk about the total number of organ transplants that have taken here? Is there any more message that you want to give to people about organ donation? What is it that they have to do excessively to be able to donate?
First of all, madam, they should take care of their health. They should take care, they keep their organs normal function. So whenever we are doing health camps, various health camps, so in that we used to put up the posters there. So what will happen if you don't take treatment for diabetes? Then there will be vision loss, your kidney will be hampered, you will get heart attack and you will get stroke. So one hypertension will cause so many things after 5 to 10 years if you don't follow this. Even in diabetes, same thing. So if they take that regular treatment, nothing will happen to them for 20 to 30 years if they are taking regular. But nowadays I'm observing that young boys are coming with stenting and angioplasty. Then they are having AV fistulas, and one young fellow with scar in the, I was just going for the examination, there was a scar in the lower abdomen. Then I asked, he said kidney transplantation was done. So it is very, what I say, very sad, or what we are not unable to educate you people, that I feel we should, we should go to you and take, I will advise you to take care of your health. Take care of your health in the good food, exercise, good sleep, then no addictions. So nowadays it is a fashion of drinks. Even women are going for the giving company to husband.
And excessively, excessively.
It is not just social, what you call?
Social drinking.
Social drinking. Why? Why social drinking? And then your liver will get damaged. And even the, can I speak that about the homosexuals and multiple partners?
Of course, yes.
It will also, you will get hepatitis B, C, papilloma virus, and VDRL. We because I'm a physician, the patients are coming with these diseases. So the
And they're increasing in number.
Yes, they are increasing in number. So this should not happen.
Yes.
You young people live healthy and make the India strong.
Absolutely. This is a gift from God, our health, our body, our mind, our soul. And we've got to really be in gratitude and appreciate all of that. Yes. So we are here at the Dr. D.Y. Patil Medical College Hospital. And let me tell you, the facility is grand. And the doctors that we have here are very empathetic, very compassionate, and very good at what they do. So over here, I think they have liver transplant, heart transplant, every other transplant that you're looking for. There is
Heart and lung transplant means at one setting, heart and lung transplant.
Yes.
And it was our second case of heart lung transplant. It was from my unit, and the young guy with the stroke, he was working for 48 hours and he fell down and he was brought by his brother. And then we counseled his brother, and at that time 7 surgeries happened in our institute, and whole institute was on the toes for 48 hours. And kidney transplantation was done, even cornea transplantation.
I have the numbers over here, in
Yes, you
fact.
can read out that. Yes.
So kidney transplant in the last 4-5 years, because that is how young the hospital is, 197 in number. Liver transplant, 61. Simultaneous kidney plus pancreas transplant,
Yes, ma'am.
03 in number. You have simultaneous liver and kidney transplant, 2 in number. You have heart transplant, 4 in number. Lung transplant, 17.
Yes, madam. Yes.
My God, that's a large number for a lung transplant.
Yes, madam. Yes.
So many respiratory problems?
Yes, madam. This respiratory problem, because of COVID also it has increased.
Okay.
Both the lungs are getting fibrosed. So the people are having, even other indications are there, but the COVID has increased the incidence of.
Wow. All right. And you have the corneal transplant, which is 86 in number. In total, over the last 4-5 years, we have 374 transplants that have taken place here at the hospital. I have gone, done a tour of this hospital, and I've really seen and taken a look at the facilities, met a couple of doctors who really want your well-being. And as Dr. Pradnya Diggikar has kept on insisting, look after your health. Eat well, sleep well, exercise, and have good positive thoughts. Do a lot of breathing, because breathing will give the oxygen to your body. Every cell in your body requires oxygen, is the prana. And definitely you will go a long way and be able to help 8 other lives if you decide to donate. I must say that this is my good fortune, because when I walked in here in the morning, I met this wonderful gentleman, Abhijit Kamre. And he was seated here at the corner, and I was wondering, what is he doing here? And then I started to discuss about, organ donation, etc. with doctor, and we were deciding on a couple of things. And then we realized that he had come here for a kidney transplant. He has waited 5 long years. What can you tell us about your experience, Abhijit?
Basically, I'm a 38-year-old and I was suffering from this disease from last 5 years.
Okay.
Last week, suddenly I got a call from D.Y. Patil Hospital, Pune. And from admission to discharge, the whole process was smooth.
Okay.
Means from doctors, surgeons, even the management. They were taking care of every patient so much that you cannot believe.
Okay.
And there is a separate isolation room. There is a personal caretaker for all transplant patients.
Okay.
And means day to day, all procedures, how the patient is going on, daily reports, in morning, in evening, regular checkup, twice a day, thrice a day. So the complete process was really smooth and everything went well. Within 7 days, I got discharged.
Okay.
From the second day, they started us to walk. So they prepared us that you need to walk, you need to do breathing exercise. That's the most important thing you need to do. You need to take care of your body.
Okay.
So they prepared us for that.
Uh-huh.
They don't miss like you just need to be on bed. So they take charge accordingly. There is a physio coming on regular basis to do the
Okay.
physios and all.
All right.
So the whole process was really well. Within 7 days, I'm standing in front of you. Today I
Okay.
came for follow-up,
All right.
and the whole process was cost effective. Other means in other hospitals it will be little bit expensive, but in this hospital it was very much cost effective for us.
Okay. Okay. And who was the doctor who operated upon you?
Basically, my treatment was going under Vishali ma'am, but the surgeon was Maske sir who did my operations.
All right.
And the entire nephrology team, anesthesia team, urology team, physio team, they every team take care of a person on the
Wonderful.
Yeah.
Wonderful. I'm glad you had such a wonderful experience
Yeah.
over here. And we pray that you get better and better and stronger every day.
Yeah, I just have an urge to all the people listening to this, kindly do the organ donation because it's a gift. It can save many's life, many people's life.
Yeah.
So that's just an urge to everyone.
Of course. All of us would urge for you, stay in good health, and if you can, and if you have that willingness, please donate your organs. It will really save very many lives. Doctor has mentioned that, he's mentioned that, and we are also asking for this. God bless you so much. Yes, it's a gift. It's a gift of life. Yes, yes. Well, thank you very much. God bless you all once again. Thank you.
Thank you, man. Thank you.
Thank you. Thank you so much. Thank you for listening to us so intently.